What are the benefits of breastfeeding? How many breastfeeding days foods to avoid when breastfeeding? Benefits of breastfeeding. Breast milk contains a lot of easily absorbed nutrients. Provides antioxidants, enzymes, immune properties and direct antibodies from the mother. The mature immune system of the mother also passes on to the baby. Thus breastfeeding helps to protect babies from disease. Immunoglobulin coatings help prevent the lining of the baby's immature intestines from leaking germs and allergens. Breast milk also contains ingredients that naturally heal babies. What is breastfeeding? Breast milk provides better nutrition for babies. Most health professionals recommend exclusive breastfeeding for at least 6 months or more. Breast milk contains all the nutrients a baby needs for the first 6 months. The secretion of breast milk will increase every month according to the needs of the baby. With the birth of a baby, a thick yellow liquid called colostrum is formed in the breasts. It is high in protein, low in sugar and contains beneficial compounds. This colostrum helps to improve the health of the digestive tract of the newborn. The baby's abdomen becomes larger and the breasts begin to produce more milk. Vitamin D is the only vitamin that is not present in breast milk. If the mother has any vitamin deficiency, she will not secrete enough breast milk. Vitamin D drops are usually recommended for the baby. As you breastfeed your baby for the first 6 months or so, you are transmitting D bodies to your baby. This benefits the baby, including reducing the risk of infections and reducing the risk of sudden infant death syndrome. What is breast milk secretion? Breastfeeding is a natural way of feeding a baby. The milk produced in the mother's body is absorbed by the baby through the nipples through the breasts. The first few hours that a baby begins to breastfeed long before it is born are called milk colostrum. It is a mostly concentrated liquid rich in protein. This makes the baby stay hydrated. Milk rich in antioxidants protects the newborn from infection. Colostrum after breastfeeding. 3 to 5 days after delivery, the colon turns into mature milk and the colostrum turns yellow. These days the baby will lose weight. This is normal. The baby will come to the body to drink breast milk. What are the benefits of breastfeeding? The important antibodies in breast milk give the baby the properties to help fight viruses and bacteria. This is important in the early months. Benefits of breastfeeding. Provides immunity. Especially the yellow density of the first milk colostrum applies to the milk. Colostrum provides high levels of immunoglobulin and many antibodies. Antibodies to the baby through breast milk give the baby immunity. It protects the baby from getting sick as it creates a safe system in the baby's nose, throat and digestive system. But this immunity will not be there for the baby drinking formula milk. Babies who do not breastfeed can have health problems such as pneumonia, diarrhea, and infections. Benefits of breastfeeding. Breastfeeding reduces the risk of disease. Breastfeeding can reduce the risk of infection in the baby. Middle ear infections, especially middle ear, throat and sinus infections can be protected from childhood. Respiratory tract infections. Breastfeeding protects against many respiratory and gastrointestinal infections. Reduces the risk of colds and infections. Intestinal infections. Breastfeeding have a reduced risk of intestinal infections. Reduces intestinal tissue damage. Sudden infant mortality syndrome is associated with a lower risk in breastfed infants. Allergic diseases are associated with less evidence of breastfeeding. Asthma, atopic dermatitis and eczema. Intestinal diseases. Infants who are breastfed may have less evidence of developing Crohn's disease and colitis. The risk of developing type 1 diabetes and non-insulin diabetes is also reduced. Breastfeeding has also been linked to reducing the risk of childhood leukemia and childhood leukemia. Benefits of breastfeeding. The baby's body weight is healthy. Breastfeeding promotes the healthy weight of the baby. It also prevents the baby from becoming obese. Studies show that breastfeeding a baby for more than 4 months significantly reduces the chances of the baby becoming overweight and obese. It is a source of good bacteria in the baby's gut due to the growth of different intestinal bacteria which will store fat. Babies who are breastfed have more leptin than a formula-fed baby. It is the main hormone for controlling appetite and fat. Benefits of breastfeeding. Babies will grow better. Studies show that there may be a difference in brain development between breastfed babies and formula milk babies. This may be due to nutritional content, physical intimacy, i.e. closeness between mother and baby, eye contact, etc. Studies show that breastfed babies are more intelligent and better able to take care of many problems as they grow. Research shows that breastfeeding has significant positive effects. Breastfeeding plays an important role in the long-term brain development of children. Benefits of breastfeeding. Lose weight of the mother. Breast milk burns more calories. Subsequent 3 months breastfeeding mothers were found to have burned fats compared to breastfeeding mothers. Benefits of breastfeeding. Beneficial to the uterus. Breastfeeding also has benefits for the fetus. The pear-shaped uterus expands throughout the abdomen during pregnancy. After childbirth, the uterus goes through a process called invasion. Thus the uterus returns to its previous size. The hormone oxytocin, which increases throughout pregnancy, helps regulate this process. The body secretes high levels of oxytocin during childbirth. This will help to deliver the baby and reduce bleeding. Breastfeeding increases the level of this oxidase in the body and promotes uterine contractions. Also reduces bleeding. The uterus returns to its previous size. Benefits of breastfeeding. Causes depression in mothers. Postpartum depression can lead to some form of depression. Breastfeeding women compared to non-breastfeeding moms. With early breastfeeding moms seem to have a lower chance of developing postpartum depression. Consult a doctor if you have symptoms of depression while breastfeeding. Benefits of breastfeeding. Prevents the risk of disease to the mother. Breast milk provides long-term protection against cancer and many other diseases. The risk of breast and ovarian cancer is lower during breastfeeding. Also prevent high blood pressure, arthritis, high blood cholesterol, heart disease, type 2 diabetes. Benefits of breastfeeding. Prevent menopause. Ovulation and menopause are stopped for breastfeeding mothers. The temporary suspension of menstrual cycles ensures that there is some time lag between pregnancies. It may be the natural way. How long can you breastfeed? Moms need to know how long they can breastfeed their baby. The baby should be exclusively breastfed for the first 6 months. Breastfeed until the end of the baby's first year. Give the baby a nutritious balanced diet by adding fresh food. When the baby switches to solid food, it should be supplemented with the best nutritious food. Especially after stopping breastfeeding. Foods to avoid when breastfeeding. Foods that cause flatulence should be avoided while breastfeeding. Avoid potatoes, mangoes and bananas. Vegetarians make sure that the baby is getting the nutrients he or she needs. Breastfeeding mothers should also avoid thyme, peppermint and cabbage. Articles, information, videos, etc. provided by the Chennai Women's Clinic and Scan Center (CWC) are for communication purposes only. These are all general articles provided by obstetricians, scan specialists, and procedures. Articles and videos on our website are generally provided on a general basis. The information and articles in the videos should not be considered as diagnostic for individuals. So do not self-medicate the treatments that are published through it. Do not self-diagnose and treat with articles and videos published on the Chennai Women's Hospital and Scan Test site. Instead, it is best to seek appropriate treatment after consulting your family doctor or health professional regarding your physical health. The information generated by the Chennai Women's Hospital and Scan Center website and print is for general medical articles only. We assure you that the articles are not published to treat any individual. So we assure you at this point that we are not in any way directly or indirectly responsible for treating someone personally.
Feel free to visit the Green Health Store on Facebook. The link will be down in the description below.